Today, we explore a remarkable case report detailing the spontaneous regression of an extruded lumbar disc herniation following 3 years of Chuzhan therapy. This story centers on a 50-year-old male who, after refusing surgery and medication, found relief and healing through a traditional Chinese medicine technique. We'll walk through his journey, the therapy itself, and the scientific context behind this unique recovery. Let's begin by understanding what lumbar disc herniation is and why this case stands out in the medical community. Lumbar disc herniation, or LDH, occurs when the soft nucleus pulposus inside a spinal disc pushes through a tear in the tougher exterior, often compressing nearby nerves. This can cause intense lower back pain, numbness, and even mobility issues. LDH is common, affecting up to 30% of people in their lifetime, and is a leading cause of disability worldwide. Treatment options range from surgery to conservative therapies, with many patients preferring non-invasive approaches due to concerns about surgical risks. LDH, both surgical and non-surgical treatments are widely used. Interestingly, research shows that long-term outcomes for many patients are similar, regardless of whether they choose surgery or conservative care. Non-surgical treatments include physical therapy, acupuncture, and manual therapies. Many patients wary of surgery opt for these less invasive options. This sets the stage for exploring alternative therapies like Chuzhan, especially when standard treatments are declined. Chuzhan therapy is a unique, non-invasive traditional Chinese medicine technique. Unlike acupuncture, which uses sharp needles to penetrate the skin, Chuzhan employs blunt-ended brass tools known as pestle needles to stimulate acupoints and meridians. This therapy is simple to learn, can be performed at home, and is recognized internationally. It's especially valued for treating orthopedic pain, including lower back issues, and is part of China's national intangible cultural heritage. Patient, a 50-year-old male driver, experienced persistent lower back pain and numbness in his right leg. His symptoms worsened after a minor injury, severely limiting his mobility in daily life. Imaging revealed a large herniated disc at the L5S1 level, compressing the nerve root. Despite recommendations for surgery, he refused invasive procedures and medications, opting instead for Chuzhan therapy as his primary treatment. Upon examination, the patient showed clear signs of nerve compression, pain radiating from his lower back to his right calf, muscle weakness, and reduced sensation. His pain was rated 8 out of 10, and his disability and function scores reflected significant impairment. CT scans confirmed a large disc herniation pressing on the S1 nerve root, classifying his condition as severe. With these findings, the stage was set for a challenging recovery. Chuzhan therapy uses 4 specialized brass tools, each designed for specific acupoints and techniques. The process involves pressing, tapping, and moving the tools along designated lines and points, such as Ye, Yongyuan, and Mingmen. Each session lasts about 20 minutes, with intensity adjusted to induce mild skin flushing without causing bruising. The therapy is gentle, non-invasive, and tailored to the patient's tolerance, making it suitable for home administration. The patient began with 20 sessions of Chuzhan therapy at the hospital, spread over 4 weeks. Each week included 5 sessions, focusing on key acupoints associated with lower back pain relief. The treatment was closely monitored by healthcare professionals, ensuring proper technique and patient safety. After just 1 month, the patient reported significant pain relief and improved mobility, marking a promising start to his conservative treatment journey. Due to work obligations, the patient could not continue hospital visits. Fortunately, his wife, a nurse, learned Chuzhan therapy through a 2-week training course. She became certified and took over his treatment at home, following the same regimen as in the hospital. This transition allowed the patient to maintain consistent therapy while managing his job as a driver, demonstrating the accessibility and practicality of Chuzhan therapy for long-term care. At home, the patient's wife carefully monitored his symptoms and documented each session. They used online check-ins and attended quarterly follow-ups at the hospital to ensure adherence and track progress. This structured approach helped maintain motivation and provided valuable data for evaluating the therapy's effectiveness. The patient's pain and disability scores continued to improve, and he experienced fewer occurrences of symptoms over time. Patient's recovery timeline is impressive. After 1 year of home-based Chuzhan therapy, his symptoms were significantly controlled. By the 2nd year, he reported substantial relief, and by the 3rd year, his pain and disability scores had nearly normalized. Regular imaging and clinical assessments confirmed ongoing improvement, highlighting the potential for long-term home-based conservative therapy in managing severe LDH. CT and MRI scans played a crucial role in tracking the patient's progress. Initial scans showed a large herniated disc compressing the S1 nerve root. After 3 years, follow-up imaging revealed a remarkable 64.8% reduction in the herniated disc size with no more nerve compression. The spinal canal diameter increased, and the patient's LDH classification improved, providing objective evidence of significant healing. Throughout the 3-year period, the patient's pain scores dropped from 8 to 0, and his disability index improved dramatically. He regained full mobility, could walk long distances, and returned to his daily activities without significant discomfort. These improvements were not only reflected in imaging but also in his quality of life, underscoring the potential of Chuzhan therapy for sustained symptom relief. Researchers proposed several mechanisms for spontaneous disc regression: inflammatory infiltration and neovascularization, dehydration of the nucleus pulposus, and enzymatic degradation with phagocytosis. Chuzhan therapy may enhance blood circulation and stimulate immune responses, potentially accelerating these natural healing processes. However, the exact mechanism remains under investigation, and more research is needed to clarify how therapies like Chuzhan contribute to disc resorption. While this case demonstrates a remarkable recovery, it's important to recognize its limitations. The study is based on a single patient, with imaging only at the beginning and end of the 3-year period. There's no control group, so it's difficult to separate the effects of Chuzhen therapy from natural healing or placebo. Larger, controlled studies are needed to confirm these findings and establish causality. Chuzhen therapy has gained international recognition and is practiced in several countries beyond China, including Germany, the Netherlands, France, and the UK. Regular training courses have enabled thousands of healthcare providers to learn this technique. Its non-invasive drug-free approach appeals to patients seeking alternatives to conventional treatments, and its adaptability for home use makes it especially attractive for long-term care. For the patient, Chuzhen therapy not only relieved his physical symptoms but also improved his psychological well-being. Learning about the regression of his herniated disc reduced his anxiety and boosted his confidence in managing his health. The ability to receive therapy at home, supported by his spouse, contributed to his overall satisfaction and adherence to the treatment plan. While both Chuzhen therapy and acupuncture are rooted in traditional Chinese medicine, they differ in technique. Acupuncture involves inserting fine needles into the skin, whereas Chuzhen uses blunt pestle needles that do not penetrate. This makes Chuzhen less intimidating for some patients and reduces the risk of complications, while still targeting the same meridians and acupoints for therapeutic effect. Chuzhen therapy is considered safe, with no reported adverse effects in this case. Its simplicity allows for rapid training of healthcare providers and even family members, making it accessible for home use. This accessibility is particularly valuable for patients with chronic conditions who may have difficulty attending frequent clinic visits. This case highlights the potential of Chuzhen therapy as a conservative treatment for LDH, but also underscores the need for more rigorous research. Randomized controlled trials with larger sample sizes are necessary to determine its true efficacy and to understand the mechanisms involved. Such studies could pave the way for broader acceptance and integration of Chuzhen therapy into mainstream medical practice. Summary: this case report documents the spontaneous regression of a severe lumbar disc herniation following 3 years of Chuzhen therapy, administered first in a hospital and then at home. The patient experienced significant pain relief, improved function, and objective healing as shown by imaging. While the findings are promising, more research is needed to confirm the benefits and mechanisms of Chuzhen therapy. For now, it offers hope as a safe, accessible, and non-invasive option for patients seeking alternatives to surgery.